To begin, let us acknowledge that Queen's University is situated on traditional Anishinaabe and Haudenosaunee territory. We are grateful to be able to live, learn, and play on these lands. We thank the Indigenous peoples of this area for their care of this land for thousands of years, and we hope to honor and respect them as we hold our virtual event today. I would also like to take a moment to thank everyone for joining our presentation today. Our speaker this afternoon is Dr. Daniel Gregson, who will be presenting on ticks from humans in Alberta. Dr. Gregson is an infectious disease physician and medical microbiologist in Calgary, Alberta, and an associate professor at the Cummings School of Medicine at the University of Calgary. He trained in Toronto, Ontario, and spent 10 years in London, Ontario before moving to Calgary. Dr. Gregson's research interests are primarily focused on the incident and outcomes from bacteremia. He is also a prior president of the Association of Medical Microbiology and Infectious Disease Canada. We will have Dr. Gregson present, and then we will open for questions from the audience. You can ask questions by entering your questions into the chat box or raising your hand using the icon. Please help us welcome Dr. Gregson to the podium.
Thank you, Veronica. That's great. So are we on the right screen here?
Yes, we are.
We are. Okay. Well, thanks for having me. This is it's interesting to talk to Canadians. I know that tick-borne diseases are more common in the eastern part of the province, and we'll talk a little bit about that as we go along. But this is where I live and work, and I don't know whether you can see my mouse. Can you guys see my mouse or not?
Just give me one. Yes, I can see it moving.
Yeah. So I'm actually sitting right here. Right now, Dr. Lewis, who's actually with us, is just over here down the way, and I see Dr. Chakonis is down here down here as well. But so this is where I live and work. You can see downtown Calgary here, just about 7 kilometers from where I sit, and you'll notice we're looking southeast because you can't see the Rocky Mountains, which are off to the right. So. This is Calgary. We're talking about ticks from all of Alberta today, and we're going to again focus on the southern part of the province. Okay. So just for disclosures, I've received no funding related to ticks or tick-borne diseases. I've actually never been bitten by a tick. Haven't had a tick-borne disease. I have nothing against ticks. In terms of land acknowledgement here in Alberta, we acknowledge the traditional territory. We're working in the traditional territories of the people of Treaty 7 in southern Alberta, which includes the Blackfoot Confederacy, Tsuut'ina First Nation, and the Stoney Nakoda Nation. And the land is also home to Mendi Nation of Alberta, region number 3. Just from the Public Health Agency Canada, looking at areas at risk of Lyme disease, and you note that there's 2 provinces here that are, or well, actually 3 provinces that are notably absent, don't have any sort of high risk for Lyme disease. I think things to note about this map would be firstly that a little bit to the west of us, they do have risks for Lyme disease, and a little bit to the east of us in Manitoba. The other thing I would point out is that many people who currently live in the province of Alberta have emigrated from areas where Lyme disease is endemic, and do travel back and forth, particularly for the cottages, family cottages in Ontario and Quebec, and also to visit relatives in the Maritimes. In terms of incidence of Lyme in Canada, you'll note that Alberta has, almost the lowest, Saskatchewan's even lower, lowest incidence of Lyme disease related to other provinces. One thing to note is that our incidence, I guess, if you looked at that map previously showing that there's risk in BC, is that the incidence in Alberta is actually about the same as BC, and most of this is related to travel to other high-risk areas, which it's difficult for us to pick that out sometimes. And that's not to say we don't actually have tick-borne diseases here in Alberta. This was a case that actually Mike Parkins picked up about 10 years back in a gentleman who was picking up golf balls in a golf course that's literally 2 kilometers from my house in downtown Calgary. And he had noted that when he was picking up these golf balls, he was getting tick bites and came in with fever and chills. And Mike actually phoned me and asked if there was a chance it was anaplasmosis. And I walked down the hallway to look at the slides with our friendly hematologist, and we were able to find morula on the hematology slides at that time. So we do have, and there's been more cases of anaplasmosis reported here as well. So we do have ticks that carry tick-borne diseases in the province. And we used to be, back in the 30s to 50s, the province was a hotspot for Rocky Mountain spotted fever down in the south eastern part of the province. But similar to what's happened in Montana, in the Bitterroot Valley, where there used to be an endemic area for Rocky Mountain spotted fever, this seems to have somehow disappeared. And there's some theories about that, which I won't go into today. So this is the province that I work in, and just to orient people who don't live in the province, I've got 2 maps here. One is the map on the left is the view of the province as per Alberta Health Services. So this is how health services are delivered in the province, and it becomes, I guess, important in terms of what the study that I'm about to talk about. So you can see there's 2 large urban areas, Edmonton and Calgary, which function to provide healthcare services to those regions. And then there's several other regions called the North, which is a very large region, Central Alberta, which obviously is the center of Alberta, which most of the work from a microbiological perspective goes into Red Deer. And then there's this area called Southern Alberta. With regards to tick identification from humans, in any case, the tick flow actually is Northern Alberta goes into Edmonton as well as all of Edmonton. Central Alberta flows into Red Deer, and the isolates from the southern part of the province flow into Calgary for ticks that are removed from humans, or where physicians want the tick identified for clinical reasons. The other point I should put out is there's various reasons for distributions of ticks in Alberta, that we have quite a varied natural regions from that point. So the Calgary sort of sits here in the south. We really abut on primarily this prairie grassland area of the province, and then relatively closely we have the Rocky Mountains, which will come into the discussion when we talk about the relative incidence of ticks in the province. Edmonton itself is more in a parkland and abutting on boreal forest and in the foothills. And Red Deer, this central zone, is primarily this parkland area with a little bit of grassland on it. So Calgary is really serving, in terms of tick identifications, this grassland area in the southeast, and then the Rocky Mountain area in the southern portion of the Rocky Mountains. While Edmonton is doing primarily this area up here. And there are definitely differences in what we see in ticks, and also differences in terms of flight patterns of migrating birds, because many of them are heading up here for the summer months, and that may actually play into some changes we see over time in the province. One of the things about living in Calgary, which is going to become evident when we start talking about ticks in the province, is this feature we have being close to the Rocky Mountains. So this is a 45-minute drive and an hour hike up from my house in downtown Calgary. So many people living in Calgary and in the Calgary surrounding region spend their weekends in areas such as this. So they're not hiking in the grasslands primarily, but up into the mountains. And that's where many of them are acquiring ticks during activities that they partake in. So these places are very popular for hiking, and it actually got worse during the epidemic. Now, this is obviously, these are tourists coming to Alberta, and you can tell that for several reasons. One is it looks like it's above zero and they have long pants on. Albertans would be in shorts by now. And you can see they're very tick aware. They've got long pants on. They probably have DEET on as well. But the other big clue that they're not Albertans is you can see this guy's holding a camera instead of bear spray. And if you're this close to a bear, you should have the bear spray out and the safety clasp off and be ready to fire it and be backing away, not standing there taking pictures. So if you come to the province for tourism reasons, please don't do this. So this is pretty typical, and this is going to be a running theme, I guess, for the month of what to do with these kind of issues. But this actually happened to me either last year or the year before during the pandemic, when I got a phone call from my niece who lives in Calgary, and she says, "I was out hiking Easter weekend and found a tick on my thigh. What should I do?" So that obviously brings up the question is, number one, what kind of tick was it? And so what are the prevalences of different ticks in the province of Alberta that bite humans? And number two, what is the prevalence of Borrelia infections and other, I guess, tick-borne diseases in ticks in Alberta? And how does one make a decision about empiric therapy, prophylaxis? And you're going to have a running theme about this in the province. So Alberta is a little bit distinct from other provinces, certainly distinct from Nova Scotia, where in essence you would say, well, this is most likely an ixodes tick, and most ixodes ticks are infected with Borrelia in Nova Scotia. And then the question is, well, how long has the insect been feeding? And well, maybe if I have time, we'll talk about that at the end. So we had this question that obviously has clinical importance for us who deal with people who've been bitten, and there are various ways one can look at this. There's obviously there's tick surveillance in Alberta, so people do active surveillance by using drag techniques. The thing about drag techniques, obviously, is you're picking up all species of ticks, even those that don't bite humans, and we have lots of, I guess, rodents in the province that can carry ticks, et cetera. There's a volunteer program called the Submitted Tick Program, where people just mail their ticks in, and they get identified. So you mail your tick in, and it gets identified, and then it's registered. There's no feedback on that to the patients, and the turnaround time is relatively slow. And ixodes ticks are sent from there to the lab, national lab for PCR for Borrelia. And then we also, as I spoke about, we do diagnostic testing. So these are ticks from humans that are submitted via physician requests, and generally you get the same day or next day identification. The results actually go in the patient record. So that goes in the patient record, and the physician gets a copy of the result in order so they can do some counseling with the patient if the patient needs reassurance from that perspective. So the question we had, because we have 3 different areas in the province that are doing testing from humans, is what is this from? What do we see in humans versus what do we see in other surveillance programs? And this is just data from our passive surveillance programs, the Submitted Tick Program for the years 2013 to 2019, where they have samples from companion animals on the left, and we've got the human or environmental samples, which is a mix of things, and then you got a total on the right, which is obviously just the sum of the two titles. So the interesting thing here is that you don't see a lot of, and you're gonna look, I'm going to talk about the Calgary zone at the end, but if you look at that human and environmental samples, there are not any ixodes ticks in that sampling done by that technique. Our ixodes are seen on companion animals, and you also see this difference in the Edmonton zone, where companion animal testing, at least in the area of 2016 to 2017, showed this marked increase in ixodes tick, and then it sort of fell off. And I guess there's some theories behind that. One of which is that we had a large burn in the northeastern part of the province. You're probably familiar with the Fort McMurray fire, where bird species probably had to relocate from that area to other parts of the province, and that may account for some of this burst in Ixodes ticks seen in the Edmonton zone. I mean, George Chaconis is on the line, and he may have some comments at the end about that. So there's a question about the replacement of the submitted tick program being replaced by eTick, which is now introduced into Alberta as well. That just started this year. So we're talking about the epidemiology of ticks submitted from humans in Alberta. So this is a collaborative effort between us in Calgary, people in Edmonton, people in the Central Zone, many people at the provincial laboratory and at the national lab, Robin Lindsay's group in particular. We've been sending all of our lab's been sending all the Ixodes for PCR testing through the Prob lab, at least since 2000 when I came to Alberta. So we have some data looking at ticks for this almost 20-year period. And we thought we would we would actually have a review of this to see if there's any difference between what we get with this, our submitted tick program versus what physicians are submitting to us in the lab, diagnostic labs here. So it was really a retrospective review of ticks. This is not a prospective study, and of ticks that were submitted from this 20-year period. We extracted the data from several different lab information systems, basically Cerner Millennium and Meditech. There are a couple of different versions of these systems in the province. Sorry. And then we reviewed the requisitions for travel history. And this is probably the largest fault with our analysis, because not everybody identifies that they had traveled when they submitted tick. So we did, if they were known travelers to other, or the tick was acquired in another part of the province, they were excluded from this sort of analysis. But I'm not sure how effective that was, and I'll get to that at the very end of the talk. And all Ixodes ticks, at least from our lab, were referred to the national lab. I guess some did not, once we actually reviewed what happened with this. So over this 10-year period, we had just over 2,300 ticks that were included in the analysis. Only about 1% were excluded due to a known travel history. And what you're going to see is that we have these submissions sort of increased every year over time. And this is just the total numbers we had. So you can see that primarily in Alberta, we have dermacentor ticks, again, primarily dermacentor andersonii. And then you see a smattering of other ticks, which many of which are probably not endemic in Alberta. So, for example, we talk about travel history. I know this Ornithodoros tick from a history of a case we had of relapsing fever was actually acquired in British Columbia. So not all travel-related ticks have been excluded from this study, unfortunately, but this is what the data we had. So if you're bitten by a tick here in Alberta, overall over the last 20 years, less than a 6% chance that your tick is going to be Ixodes. And this is just looks at the year-to-year variation in tick speciation. Just note, I guess, on this graph that we started 82%, not at 1%. So there's a little bit of a bias when you visualize this graph against dermacenters, but essentially over the years we have this mild fluctuation of Ixodes ticks occurring in the province, and then primarily these dermacenter ticks being the primary species we identify. And you'll note that submissions really increased over time, particularly starting in 2013. And that's just, I think, patient awareness that they can get their ticks identified through, and physician awareness that they can get their patients identified through this process. So there's some, and again, when you're looking at this slide here, we have some regional variations. You see what's common through all of these slides is that there's a definite increase in tick in tick submissions over time, and particularly with regards to dermocentric ticks. So you're seeing this large increase in ticks, and there again, the increase is primarily related to the increase in dermocentric submissions. The other point I would have here when you look at ticks is that in Calgary in 2019 we had 300 ticks submitted, and in the rest of the province they had less than 300 ticks submitted total. So most of the tick submissions, at least going through this route, are actually coming through Calgary, and you can see this slight increase in Ixodes ticks over time, but that's really not as a percentage of increasing relative to the number of ticks that are being submitted. So we are seeing more Ixodes ticks, but not more in terms of a percentage of submissions over time. So you can ask why this is, and we'll get to that. So part of this is what people do in Calgary. I don't know that there's a lot of people are spending times in these Rocky Mountains, and that's where most of these ticks are picked up, at least locally. We do have a tick season here, and it varies from year to year, and presumably this is part of the variation in climate we get. So Alberta has winter any time of the year, so presumably this has something to do with when our spring actually starts. You can see that variations in terms of when is tick season starting and when does tick season peak. Tick season here usually peaks in the month of May, with this gradual tail off and sort of disappears in September, and then starts somewhere between the middle of March or end of February to the beginning of April. So we have definitely noticed the tick season start, at least submission start at a specific time of year related to climate and people engaging in hiking activities. So when we submitted ticks now, of all these ticks we had, only again less than 6% were Ixodes, and primarily Ixodes scapularis. These Pacificus, I don't know whether these are supposedly acquired in Alberta, but I must admit there's a lot of travel back and forth into British Columbia, and we may not have accurate testing. So, and again, in terms of testing these ticks, we're looking at about 10% of all ticks being tested for Borrelia of Ixodes scapularis being positive, and that those are, now if you look overall, so we're looking at only 6% of ticks being positive for being Ixodes ticks, and only 10% having Borrelia burgdorferi, and that's results in a relatively low risk of transmission from any given tick bite. So once you know that it Ixodes, then you're looking at how long has this tick been feeding for. We do tend to have more Ixodes positive in southern Alberta, but that's probably related to the fact that we're submitting more ticks than other parts of the province. And then we do have this relatively low incidence in Ixodes of anaplasmosis, and again, those were all submitted from the Calgary zone, and we didn't identify any Babesia or any other Borrelia species in the Ixodes ticks that were submitted. Although we do see occasionally relapsing fever acquired in British Columbia. It'll be interesting to see how the BC tick surveillance compares to ours, as they have different species of ticks, obviously in that province. So there's overall in the province of Alberta, we have this propensity for dermacentra as our local ticks. We have a relatively low incidence of other ticks in the province, and when we do identify Ixodes species, we have a relatively low incidence of infection with Borrelia burgdorferi and other pathogens. so that really looks at what happens in Alberta in the last 20 years. And we had this event over the last 2 years called the COVID pandemic, where people couldn't travel. So it's sort of a natural experiment in terms of how much travel associated ticks are we identifying, because people couldn't travel. So if the only place you could go was Alberta, and although people did sneak into BC, the only place you could pick your tick up would be in the province of Alberta. And in addition to that factor that you couldn't travel anywhere, we also had this thing where everybody went to the mountains on weekends. So this is a parking lot for a hiking area, just probably about 45 minutes from Calgary, which doesn't usually look like this. So this is over the last 2 years. I mean, you could not park at a hiking space if you weren't there before 9 o'clock. I was at Lake Louise in July of 2020, and the parking lot at Lake Louise was full at 7:30 in the morning. So people were, because they couldn't do much else, they were getting out and hiking and biking and essentially spending time in the parks. So one would have expected that with this weekly migration to the mountains, and it really was weekly, I mean, it was quite crowded in the park, that we would see in Alberta, at least in Calgary, the Calgary area, people getting out and acquiring more ticks, and acquiring their ticks locally as opposed to acquiring their ticks during travel for the most part. So I thought I would, for the purpose of this talk, look at what's actually happened in the southern Alberta zone. So this includes all ticks in southern Alberta rather than just the Calgary zone. But again, from 2010 to 2019, you're looking at all ticks being submitted and people including whether or not they traveled. So we have this yearly increase in the number of ticks being submitted. We have this relative increase in the number of exoides ticks that are being submitted. So you can see that we have a low year here in 2011 where we had no exoides actually submitted, although we have a relatively small number of ticks submitted altogether, to 2019 when we saw a 7% incidence of exoides ticks in the ones that were submitted from humans. So this increasing trend in exoides ticks to 2019 with this increasing marked increase in number of dermocenters being submitted. So not a large number of ticks, but still on a percentage basis, an increase. And surprisingly, what I thought was going to happen in 2020 and 2021 would be a increase in the number of ticks altogether that were being submitted, with a change in travel-related ticks. So if you look 2020, you can see that we actually dropped in terms of tick submissions, including the dermocenters, marked drop in exoides species being submitted. And then again in 2021, we have this even further drop in what's being submitted, and an even further smaller percentage of those being exoides ticks. So we go from our high of 7% to a low of 1.5% over a period of 2 years, and those 2 years being associated with the pandemic. So that of course begs the question as to how many of these ticks in 2019 were actually travel related to outside of the province. And we talked about ballparking your risk of getting a exoides tick bite in the province of Alberta, just saying, well, overall it's a relatively small proportion and you don't really need to worry about it. But when you look at it by month, so these are our tick bites by month in Alberta over that 20-year period. Not in Alberta, sorry, this is just the Calgary zone. When you look at that by month, what we actually have is a dermocenter season that runs from March to August, with relatively low incidence of other species during those months. When you get out of those months, we actually see more exoides ticks in the months of October than we do dermocenter ticks. So dermocenters are essentially gone by here. And then all we're seeing now, whether these are travel related or acquired locally, I can't tell you, but it's sort of the same rate across these months. So we're sort of, that's an interesting feature that, in fact, if you're getting a tick bite in Alberta in September, October, November, it's more higher risk of being actually an ixodes tick than being a dermocentric tick. The other question we have, and this is going to be a question for many people who are doing tick testing, is not only is it the question what tick has been feeding on you, but the question is, how long has this tick been feeding? And we at least for ixodes ticks keep track of how long we think the tick has been feeding. So this is basically, again, George Chaconis is probably going to have more information on this after I finish speaking, but really old data from they're using, this is actually a publication from 2018 where they're looking at ticks in the New York area and which percentage actually have been feeding for longer than 36 hours when they're removed from patients. So in actual fact, most tick bites are identified before the 36 hours sort of cutoff where one might be considering a high risk of transmission of Borrelia species. This is really based on a relatively old paper looking at scuttle indexes, which is really published in 1996. And I don't know how other people are doing their scuttle indices in their laboratories in terms of trying to make a cutoff for ixodes feeding times. And so we in our lab have a cutoff for adults at about 2.5, and for nymphs at about just under that 2.5 cutoff. So you can actually, again, look at what is the species of tick, and what is the feeding time to sort of get these risk factors for transmission, and what is your incidence of Borrelia in your ixodes population to make decisions about treatment or further testing on patients who have been feeding their ticks inadvertently. So I think I'm going to leave it open, or leave it from there. And I want just maybe invite Dr. Chaconis to maybe add a few comments about what he's been doing in his lab, and what his issues with ticks are, and some of this data I just presented. So George, do you have any comments? Sorry, I'm putting you on the spot.
That's okay. You can put me on the spot, Dan. I actually don't really have any comments, just because everything that we do in my lab uses the long-term mouse model or short-term mouse model. So they're all laboratory mice that we're infecting. And so doesn't really relate to the very important data on real ticks in the real environment.
Right. Okay, that's fair enough. Maybe someone else in the audience has some comments about, what happened in our ideas, but what happened in 2020 and 2021 in terms of our, there are various reasons why our tick submissions could drop. One is people just aren't interested in submitting ticks anymore. And that may be true, or there may have been a real drop in the number of tick bites occurring in people heading to the mountains. I would have expected the opposite, actually, in terms of dermocentric ticks, at least, that we'd see more dermocentric ticks during those 2 years than we actually did.
Just one comment I'd make about that is, I agree with you. It's a little perplexing in a sense. On the other hand, suddenly the increase in people going to the mountains for their diversion and recreation, as you mentioned, really soared. And maybe along with that, maybe something good, which is that maybe suddenly people are becoming much more aware of ticks and realizing that, they're out there, and getting rid of them early on. And so you never end up seeing them in terms of submissions. They just kind of pitch them out and throw them away if they see them. But lots of people on the trail, somebody has a tick. There are lots of people who can advise them on what to do, how to take it off, and et cetera, et cetera. So I don't know.
Yeah, we see lots of ticks with no heads on them that are submitted. So I wish that was true. So I'll ask any questions from the audience, I guess. We've got not too much in the chat box.
Dr. Gregson, I see that Dr. Savage has her hand up.
Sure.
Hi. So I was just looking. So one of the, maybe I wouldn't say the reasons, but if you take a quick look on ETIC for 2021, so the program started or folded out in Alberta in late April of last year. And for the full year, there were about 500 dermacentaurs, but there were 236 of these submissions from humans. So, and because this was the beginning of the program, how much, and of course we do not recommend, or based on the recommendations from the public health team from Alberta, there were no requests made to have the dermacentaur ticks sent anywhere. And so there have been quite a lot of human dermacentaur bites in 2021, but I don't know how many of these ticks would have actually made it to your lab, since it was not a recommendation to have those sent out. On the other hand, though, we also got about 60 submission for Ixodes scapularis that did not have a traveling history, but only one of these were from humans. And of course, now and so there's some differences here between what's been seen on the ETIC platform and some of the data that you've presented, which is quite normal. But at least for dermacentaur, there were quite a bit in 2021. And my other, so this was just a comment, maybe sort of providing a little bit of an inkling into what might have happened for the 2021 season. My other question was, all the data presented today was based on just the human ticks, correct?
That's correct. Except the one slide I showed about the environmental sampling. So they had clustered their humans and environmental into one group.
Because now I know that for at least from the lab with discussions with Kinga from last year, all of the Ixodes ticks, regardless of host, are being sent to the lab in Alberta. So I don't know how or if these ticks are tested. Well, actually, I do know that these ticks are tested, or how the data is taken into account, but it's almost all ticks from dogs, literally.
Yeah, we have a gap year, so to speak. Robin's lab has stopped testing ticks for us. So we're in the process of setting up a way of doing the tests directly here in the province of Alberta. So we're setting up PCRs for both Borrelia species and also for anaplasma. There's discussions about rickettsias, but those are we haven't seen a lot of Rocky Mountain spotted people here lately, and there's a lot of I guess there are non-pathogenic rickettsias in tick species that you have to get around your amplification for to sort of identify that it's not a non-pathogenic rickettsia. So I don't know that they're going to go as far as that. We are in the process of, in terms of validation, sending all ticks. We're getting, at least for clinical diagnostics in Calgary, to that lab for while they're setting things up for controls. We haven't had this season. We've only had one Ixodes tick so far, and it's only the 1st of May, and the Ixodes we sort of see scattered throughout the year.
We've made some requests so we got 6 from animals from ETIC. So I don't know how many people have sent those to you, but all the requests have been made. So hopefully
the ones from animals will go through, just put in the mail, just put an envelope and go to the mail. So so then the only Ixodes tick we got was somebody had acquired that in the States and had kept it for 2 weeks before they submitted it. So it was quite shriveled up and we couldn't do a scuttle index on it. So yeah, so people are very attached to their ticks. We occasionally get people when they submit them, call us and say, I'd like my tick back after we identify it, and we go, well, I can't do that. So the ETIC program will be good in that way. I think that, I've looked at the ETIC program and I have some visualization issues. I can't really visualize what's where in the province of Alberta directly. So I think that would be helpful if we could cluster those through locally, not just in the province, but local.
Oh, you can see all of them on the map directly.
Well, yeah. Okay, fair enough. I just can't do a head count. I always like the denominators, so I have problems with on the map. All I can see is one exoides. As far as I can tell from 2021.
From humans.
From
It's
humans, right?
selected
From
only
humans.
Yes, there's
From
only
humans.
one from humans.
Yeah.
There's 60 from dogs.
Yeah. Well, yeah, that's the thing. As George pointed out, Albertans are fairly good at staying on the path for a variety of reasons. One is you don't want to wreck the environment, and two is you don't want to pick up a tick, and three, you don't want to bump into a bear. Yeah, the dogs don't do that. If many people, when they go hiking with their dog, the dog is, if they're not, the dog is usually under control, but may not be on the path. When you're out hiking, I do see lots of people with their dogs off leash, which is not a safe thing to do, because if the dog encounters a bear, they run to you, and that brings the bear to you. So we try to encourage people to not just carry bear spray, but also keep their dogs on a leash.
All right, thank you.
Dr. Gregson, Dr. Evans has his hand up.
Yep. Oh, Gerald, how are you?
Not too bad, Dan. How are you? Great talk. Thanks for this kind of interesting stuff. Reminds me of my days in Alberta some 3 decades ago, being up in the mountains. So I guess I have a quick question, and actually it looks like Sean offered the same question. So knowing that dermacentrics can carry Rocky Mountain spotted fever, tularemia, and actually have been sort of implicated to some degree in anaplasmosis and ehrlichiosis, any suggestion in the human disease surveillance that those reportable diseases have increased, given so many dermacentric ticks being found in this surveillance system? Yeah, that's an interesting observation, that we haven't had a lot of Rocky Mountain spotted fever here in the province of Alberta. And even when we did have it back in the 30s and 40s and 50s, it was really localized to the area around Manyberries, Alberta, which is, since you lived here once, maybe it's in the southeast, right? Not just right. Yeah, down towards Lethbridge.
Everyone knows where Coots is, because that's where one of the blockades was. So it's just east of Coots, and a little bit north is where Manyberries was. So they described about 15 or 20 cases of Rocky Mountain spotted fever in Alberta, all localized to that region. And again, when you looked at Rocky Mountain spotted fever in Montana in the same period of time when these things were being investigated relatively intensely, that in the Bitterroot Valley, what we've seen is sort of a loss of rickettsia in those regions. So we no longer see that in the ticks in the Manyberries area or in the Bitterroot Valley. And the hypothesis is, and I don't know, I'm not a tick entomologist, but the hypothesis is that the rickettsia have been replaced in the tick population by non-pathogenic rickettsia species. Apparently, and I'm not a tick, being infected with rickettsia is not that healthy for the tick either. And I guess having a non-pathogenic rickettsia really prolongs your lifespan as a tick in the environment. So that's the hypothesis. And again, we have not seen, I've not seen a case reported in Alberta. There was one, Lenora presented one case of potential Rocky Mountain spotted fever at our annual Alberta ID meetings over 5 years ago, and I've not heard of anything since then.
Thank you, Dr.
Cool.
Gregson. There's a comment in the chat box from Dr. Lewis. Does more people in the mountains equal more ticks? If humans are not a wild vector and most people follow the same trails, maybe we've already passed the saturation point for picking up the wild ticks. Response to that, and then afterwards, Dr. Colati has his hand up.
Yeah, I think George spoke to that as well. That there's several things that happen. Obviously, we had this epidemic of people going to the mountains, and we've also had this educational program going on for years about prevention of tick bites. So most people are aware of permethrin pants, roll up your sock, tuck your socks in like Justin Bieber. Staying on the path, doing tick checks on a regular basis. So That's pretty well ingrained in most hikers in Alberta. So it may be that, and in combination with the path staying is done it for us. I don't know. I don't have a. The other thing is, maybe so many people went out 1 week and got all the ticks. There's no more ticks left. I don't know. Another possibility.
Dr. Evans added a trivia note that Willie Borgdorfy worked at Rocky Mountain Labs in Hamilton, Montana. That's a little trivia out there, and I'll pass it over to Dr. Colati.
We're going to have a trivia contest here. I got lost. Okay. Sorry, next question. Yeah.
I was just going to mention we have a lot of the Rickettsia buchneri bacteria in ticks here, and I was wondering if it's the same bacteria that might be replacing Rickettsia there. But sorry, yeah.
Yeah, I don't have I know there's a non-pathogenic Rickettsia that's now present in the ticks in the Bitterroot Valley. So I presumably if you search PubMed for Bitterroot and ticks and species Rickettsia, you'll find that. I don't know exactly what species is, but I think there is some data showing that ticks with Rickettsia don't overwinter quite as well as ticks that are infected with the other species. So that may be why it's obviously that's a selection bias when you do that in your tick species, and it's hypothesized as a reason why we're not seeing it anymore. It would be interesting from an environmental perspective if you had something similar for and this is for George, I guess, for Borrelia. If you could infect your Borrelia species with non-pathogenic Borrelia and not have any more Lyme transmission, that'd be great too.
Actually, that was just a thought. The question I actually had was about, you mentioned amblyoma. I was wondering if that was the Lone Star tick or a different species.
They're Lone Stars, yeah. The ones we get. And I don't think these are, we have the bird flight path, migrating bird flight path is really up from the central US up the Mississippi Valley and then into northern Alberta. So we believe that most of these are just coming on ticks during bird migrations. And I can't say the same for Exoides. I don't know whether Exoides can actually overwinter in Alberta. We have this, we do have winter and summer, and we have summer and winter. And it really does have, the freeze. I think some data showing that freeze thaw is a bad thing for overwintering ticks, and it's pretty Exoides species. I haven't seen anything on dermacenters, but that's an environmental feature we have that many other parts of Canada do not. And by winter and summer and winter, I mean it can go from 20 below to 10 above in hours here in southern Alberta.
Thanks.
Thank you. We have Dr. Durgosov has indicated that also Rocky Mountain wood tick populations are very spotty in the Rocky Mountains, more found in southern Alberta, and the symbiotic Rickettsia in wood ticks is Rickettsia peacocki. I think it's a little bit more trivia out there for everybody.
Well, that's great. That's I couldn't remember the name. So thank you very much for that, Sean.
We still have a couple more minutes. If anybody else has any questions for Dr. Gregson, please put them in the chat box or raise your hand or unmute. Just doing a quick look to see if there's any hands raised.
I have Terry.
Go ahead, Terry.
Hi, I just want to thank you so much for your presentation, and I love learning, so this has been fantastic. Thank you so kindly.
Oh, you're welcome. It's a pleasure to do this. And I know that Veronica and the group have been busy with lots of people coming on board. There's going to be a lot of interesting presentations over the next month, and unfortunately, I'll make some of them, but I won't make them all. And I think that it's interesting to have. I think many people are interested in the ticks and not just ticks but other tick-borne diseases and why things come and go. And not too sure why we have so few Exoides over the last 2 years when I would have expected more.
Thank you. One last call out there. Do we have any more questions for Dr. Gregson before I wrap it up for today? Don't be shy. Okay, hearing none, I'm just gonna stop your screen, Dr. Gregson, so I could share this one with everybody. So again, thank you so much, Dr. Gregson, for your presentation today. I just wanted to let everybody know that tomorrow's presentation has been postponed. Unfortunately, our presenter was not available. So we had to cancel tomorrow's presentation at noon, but we will be back on Wednesday, May the 4th. At 12 o'clock Eastern Standard Time. We have Dr. Adrian Baranchuk presenting on Lyme carditis. Do I need to be checked? I also wanted to remind everybody on the call that if you have an opportunity, please take part in our challenge. Wear green or wear a green face mask. Take a photo and share it with us to help spread awareness for Lyme disease. If you don't like to send your personal photos in, but are very creative, feel free to make a drawing that represents Lyme Month. All entries that we received will be entered in a draw for one of four $25 Starbucks Eve gift cards, and our draw will occur on our last day of our presentations on May 31st. And again, you can send your photos or drawings to clydern@gmail.com. I'm just checking, and yes, it is. It's May the Force be with you on Wednesday. We'll have to remind Dr. Baranchuk that. Maybe he'll be dressed up for us, for all you Trek, Star Wars. I was going to say Trekkie because my husband also likes Star Trek. So that is it for today. Thank you again, and I hope you have a great rest of your day. Take care, everybody.